Everybody is familiar with the Robert Frost poem that ends famously with the stanza, "Two roads diverged in a wood, and I took the one less traveled, and it has made all the difference." I'm sure a lot of politicians have quoted that particular poem and that last stanza of that poem. But I think it has a particular application to your Saskatchewan right now in 2010. I can't say exactly when. I don't know for sure. Maybe you can't pick the exact date either. It was probably, frankly, before the election. But some years ago, we decided collectively, notwithstanding who the government was, to take a new road in Saskatchewan, a less traveled road. And I believe today in Moose Jaw and across our province that has made all the difference. It hasn't been the government. It hasn't been policies that you've helped implement. I hope they've helped, but really it's been the choice that you made as individuals. It's been an attitudinal change by Saskatchewan people that has made all the difference. The decision, whenever it happened, didn't change our core values, didn't change who we are. Our prairie humility is unfaded, but it did change our vision, I think, collectively. And it has given us a humble self-assuredness about where we are today and where we're going to go tomorrow. You know, it wasn't very long ago that political leaders in this province would say things like it was impossible for Saskatchewan's population to grow even at the national average. We could give you the quotes. Where political leaders not very long ago would say it is statistically impossible for this province to grow its population even at the national average, which is only 1% a year. But here on this less traveled path, the sign markers tell a different story, don't they? It's where Saskatchewan people ask the question, well, why would that be the case? With all that we've been providentially blessed with the resources that would be the envy of nations, never mind other provinces or states, why would it be that we wouldn't aspire to growth? Why wouldn't we be aspiring to be the kind of place that people would be attracted to, that people would flock to? Ladies and gentlemen, we know now, and Sierra touched on it, that we can't grow at the national average here lately. We are almost doubling the national average in terms of population growth. There are more people in every city. There are more people in towns across this province of ours. There are more people in service clubs. There are more people to volunteer for efforts. There's more people in church on Sunday morning. There are more members of the Rider Nation than there has ever been. There was one too many members of the Rider Nation last November. But there won't be on Sunday. There'll be just the right number of members of the Rider Nation on Sunday. And here, even someone from Swift Current and a whole bunch of folks from Moose Jaw area, here we can agree on sports, I think. By the way, greetings from the home of the Swift Current Broncos. We're only 1 point ahead of you in the standings right now in second, but I think it could get worse for you folks as the season goes on. On the old road, our leaders said that we ought not to get used to being a have-not province. Leadership said that even when we had become a have province under the previous government, let's be transparent about that, but even at that, when the news broke that we had become a have province, political leadership at the time said, and I quote, that we ought not to get too excited because, quote, we will always be in and out of equalization. But here on this road less traveled that we're on today together, we have a different view. We have a different vision, we have a different understanding, and we know with clarity that because of the strength of our economy, because of all of you, because of our resources, that we are a have province today, giving more to the country than we ever need to get back in return, and we intend and we will stay a have province in the Dominion of Canada, giving more back to the country than we'll ever get back in return. In the old Saskatchewan, our values were different. Even our expectations were a little bit lower. In the old Saskatchewan, the Riders would lose or say they were going to win 9 games and lose 9 games, and we'd kind of expect it. In the new Saskatchewan, we're mad when they don't win in regular. It's true. It's because it's very hard on our hearts if we have to go through what we went through on Sunday. We launched a new advertising campaign for the province, you probably heard, and they asked me about the game on Sunday, would we be advertising in the Western Final, and I said, yeah, there should only be 2 things promoted during that Western Final. One is the great province of Saskatchewan, and the other one is heart medicine. In the old Saskatchewan, ladies and gentlemen, there was a lot of talk about some long-standing problems that lasted for, 16 years, give or take. In healthcare, there was always a lot of talk about the challenges. There was talk about wait times, and yet nursing positions were cut dramatically and significantly. There was a lot of talk about a doctor shortage then, but we never increased the number of medical seats at the University of Saskatchewan College of Medicine. We never increased the number of residency positions so that we could have a better chance of keeping doctors here in Saskatchewan after they've been trained in here. There was talk about rural health care, but then 52 hospitals were closed in rural Saskatchewan. In the new Saskatchewan, ladies and gentlemen, though we have a lot of work to do to make sure we're providing that kind of health care that people in this province deserve, but in the new Saskatchewan, actions speak louder than words. We set a goal to hire 800 new nurses in the province. We said that we'd get there in 4 years. We're there today in 3 years. We said we shouldn't have only 60 training seats at the college. By the way, among the lowest numbers in the country, we should have 100 new medical seats for training doctors. We're going to get there before the end of our term. We said we should double the number of residency positions in the province, because if you have more residents, you have a chance to keep those doctors here in the province. We'll get there as well. We're almost at that 120 goal already. We'll get there well in advance of our own target. We've set a wait list initiative in place, as you know, in Saskatchewan, that says that within 4 years, wait times are going to be less than 3 months for surgery, and we are making progress in this regard. I had a great conversation with someone from Yorkton the other day. We were speaking there at an event, and a fellow came up to me at the end and said, you know, I had an accident a little while ago and it hurt my knee really bad, and I finally went to the doctor. This story happened, by the way, in early October, I guess, is when this exchange happened. He said, I went to see the doctor in September and got in to see a specialist, and he said, you're going to need arthroscopic surgery on that. And I said, okay, well, doctor, when's that going to be? And he said, well, probably in November sometime. And he was thinking to himself, so November 2011, right? But you may have heard about our wait times initiative, where we've said we're going to engage with the private sector within the public system. We're going to provide some surgeries and some treatments for people when they need it in the public system, even if we have to engage the public sector. And the manifest results of that initiative were apparent to this gentleman, because the doctor, the specialist, said, no, I don't mean November 2011, I mean in 2 months. You can have your surgery at the Omni Clinic in Regina because of the surgical wait times initiative that's in place today in Saskatchewan. It was interesting. I said, well, what did you say? He said, you know, I really wasn't ready for the surgery that soon. I haven't decided if I'm going to take him up on that. In the new Saskatchewan, ladies and gentlemen, we've said people don't need ideology, they need arthroscopic surgery. And so let's provide it to them in the public system, even if we're engaging with the private clinics. Ladies and gentlemen, we've made significant investments here in Moose Jaw. As you know, the funding for planning for a new Moose Jaw hospital has been advanced at $450,000, and it'll put us in a good spot to make the right decision for the people of Moose Jaw with respect to a hospital that's needed, obviously, here in this growing and vibrant community. We've invested $650,000 of the $2 million needed to revitalize the 35-year-old intensive care unit at the hospital to ensure patients and staff are safe, obviously, and to implement important infection control capabilities in that unit for patients. And then last fall, again, right here in the city, we launched the first phase of the colorectal cancer screening program we committed to in the campaign. Under the auspices of the Saskatchewan Cancer Agency, it's being spearheaded right here in the friendly city, the city of Moose Jaw, and we've seen some encouraging results, by the way, in showing the benefits of early detection and diagnosis. We're going to do more of that kind of thing. We're going to engage the regional centers of our province in primary health care. There's residency positions currently in the city of Swift Current. We can lead in colorectal cancer screening here in Moose Jaw. We can engage with the regions and with the centers to improve health care for people right across this province, and we're going to do that. In the old Saskatchewan, there was a lot of talk about how much we depended on property taxes to fund education. Lots of talk. At SARM conventions and SUMA conventions. And there every once in a while was a rebate program the government would implement, but never a long-term solution. Well, that's changed as well, ladies and gentlemen. In the new Saskatchewan, we have implemented that new basic mill rate right across the province. We have reduced the need to fund education from property tax. And by the way, in this next budget, you're going to see the government keep its second phase of the promise we've made and deliver the largest property tax relief in the history of the province of Saskatchewan. In the old Saskatchewan, there was a lot of talk about agriculture. And if you chat, if you chat with Bob Benrod, he'll be able to tell you a lot about the talk that used to exist around agriculture. But while the talking was going on, GRIP was ripped up. The province of Saskatchewan was MIA in terms of the national discussion on federal agricultural programs. The long-term education property tax issue was neglected, very important on the farm. In the new Saskatchewan, actions have spoken louder than words. We've been there early on with some loans for our hog and beef sector. We've also provided some more direct assistance in the months that followed, water infrastructure programs in the Southwest, fully funded agricultural programs, and Saskatchewan is again today, and a salute to Bob Benrod, is again today, as it was under the administration of Mr. Devine. Saskatchewan now is a national leader in terms of agricultural policy, exactly where we should be. Exactly where we should be.